A spinal headache in medical terms is called a post-dural puncture headache. It can happen after a spinal tap, aka a lumbar puncture, a spinal block, aka spinal anesthesia, or a wet tap. For a spinal tap, a small hollow needle is inserted between the lumbar vertebrae, the bones in the lower back, until it reaches the spinal space, which is where the cerebrospinal fluid lives. And that fluid drips out of the needle like a tap or faucet, and we can then collect it and analyze it and make a diagnosis. The chance of getting a headache after one of these procedures can be pretty significant, but really depends on a lot of factors. One being the needle's size. The larger the needle, the higher risk. For a spinal block, spinal anesthesia, same thing with needle placement, except once we see that fluid come towards the end of the needle, we attach a syringe before it can drip out, and that syringe has medication in it. We inject that medication into the spinal fluid, and once it's all in, we remove the needle. Much lower chance of a headache with a spinal anesthetic. And when we use the smallest needle, a 27 gauge needle, that risk near zero. A wet tap is when an epidural needle, not a spinal needle, not one meant to go into where that fluid is inserted too far past the epidural space into the spinal space, and that spinal fluid drips out. Epidural needles are much larger than the spinal needles, which are meant to go into the spinal space. So the chance of a headache is highest when this happens.